Welcome. Hope you're having a great day today. My name is Travis Chepkema. I'm president of Church and Casualty Insurance Agency. We're happy to have you here as part of our complying with the new Cal-OSHA COVID-19 guidelines. This will be a 1-hour presentation today. Our presenter will be presenting till 1:45, and then we'll take some questions at 1:45 till 2 o'clock. We're excited to be a 37-year-old agency that is the largest insurer of houses of worship in the Southwestern United States. We insure nearly 7,000 organizations, and we're happy to provide risk management when we can, and especially in the year of 2020 via this format. So a couple things to let you know. Number one, this will be recorded. So you will be sent a link of this recording a little bit later. And number two, there is a Q&A feature that you can use privately throughout the presentation. That is right down there. There's a button that says Q&A. You can post your questions there. And then third, joining me here on the screen, in addition to our presenter, who I'll get to in a second, is Brittany Bowie, our sales and marketing coordinator. Brittany will be coordinating those questions and asking our presenter at the 1:45 mark. So feel free to send in your questions and we'll get to as many as we can. Erick Becker leads the Labor and Employment Practice Group at Cummins White. With 30 years of practical experience in labor and employee relations, his expertise centers on helping employers maintain compliance with the myriad laws and regulations governing employment. He works with clients in a wide variety of industries, including construction, manufacturing, transportation, nonprofits, which is you guys, and healthcare. He also teaches a course on human resource and the law for the Human Resource Management Program at UCI, and regularly speaks on employment and labor issues for industry and professional organizations. Our agency has personal experience working with Mr. Becker, and so we're very glad to have him join us. So with that said, Erick, please take it away.
Thank you, Travis. Good afternoon, everybody. I am going to share my screen with a PowerPoint presentation on this topic of complying with the new Cal-OSHA COVID-19 regulations. I work in Newport Beach for Cummins White, and I handle all aspects of employment law. But of course, over the last 8 months, a big part of my practice has been answering questions on how do we deal with all of the various employment-related issues that the COVID pandemic has raised. And recently, and when I say recently, I mean November 30th, this new Cal-OSHA emergency regulation was dropped in our lap. And frankly, the state did not give employers or the people who advise employers a heck of a whole lot of time to figure out exactly what this means and what we have to do to comply. Since then, there has been further frequently asked questions and some other things that have come out from Cal-OSHA on the regulations. But frankly, as we sit here today, there still are a lot of unknowns about exactly how Cal-OSHA is going to view compliance with these regulations. Anytime they issue regulations like this, there's always going to be ambiguities. And unfortunately, that's one of the things that we as employers have to deal with. So I'm going to point out some of those ambiguities as we go through the regulations today. There's a lot of material. There's a lot of things to digest. I'm not going to hit on every single aspect of the regulations because frankly, in 45 minutes, that's just not possible. But I am going to try to hit on as much of the critical information about these regulations that you need to know as employers in the 45 minutes that we have. And of course, at the end, we'll be able to answer some questions that you may have. So, let me first give you a broad overview of the regulations and what they contain. So the regulations, which I said became effective on November 30th, govern most workplaces in California. So it doesn't matter really your size, except for one exception that we'll talk about, or the type of industry, or even whether you're a nonprofit or profit. These regulations govern all workplaces. And these regulations are emergency regulations, so they will be in effect for at least 180 days, which takes us to May 31st of next year. It's possible that the regulations could be codified and extended beyond that, but as of right now, this is what we have to deal with for the next 6 months. Now, there are a couple of exceptions. If you have a workplace that just has one employee, then you don't have to worry about this regulations. Obviously, very, very few people out there that have a business with just one employee, but if you have that situation, then no need to worry. It also does not govern when you have employees who are solely working from home. In other words, they're not going to a centralized workplace for the employer. So unless you fall under one of those two exceptions and you're in California, you have to worry about these regulations. Now, these are the main requirements, kind of broad overview, and then we'll get into some of the details regarding each of these sections. The first requirement under the new emergency regulations is you have to maintain a written COVID-19 prevention program. And I just noted I put 2 I's in COVID. That was a mistake. I've typed in COVID so many times, I don't even know sometimes whether I'm spelling it correctly. So you have to have a written program. Now, many of you probably already developed a written program in accordance with the California guidelines that were issued towards the start of the pandemic for employers. It's important to recognize that even if you have a prevention program currently in place, you need to look at the regulations to determine whether your current prevention program meets all of the requirements of these new regulations. But that's the first important thing that you have to have. Second, you have to communicate with your employees regarding COVID exposures in the workplace. And we'll talk about what those communications must be. But the regulations have a number of different requirements for communicating about employees regarding COVID. Third, you need to provide prevention training for employees. Again, many of you probably provided the training that was suggested by the state, not Cal-OSHA, but the state of California, back at the start of the pandemic. Training on things like wearing masks, washing your hands, recognizing the symptoms, etc. But those were just guidelines for reopening under the state. These are now regulations that you have to comply with. I'm not going to talk a lot about that training today because a lot of companies are out there providing that training, and it's pretty straightforward in the regulations. But I did want to mention that you do need to conduct that training with your employees. And again, it's on basics like recognizing the symptoms, maintaining social distancing, all the things we've gotten used to through the course of this pandemic. Next, and this is more of a new regulation, even though Cal-OSHA had suggested previously that you have to do this, and that is identifying where you have a hazard for COVID exposure or COVID transmission in the workplace, and then correcting that. For instance, situations where you have people working within 6 feet of each other, that could lead to COVID transmission. So you need to make sure that you are taking proactive steps to identify those situations and then doing what you can to correct that so that you are trying to prevent further transmission in the workplace. Next, the regulations have specific requirements regarding physical distancing in the workplace and wearing of face coverings. Prior to this, the wearing of face coverings was not as explicitly spelled out and with as much detail, which I'll get into. But now Cal-OSHA says all employers must require their employees to wear face coverings and maintain social distancing in the workplace. Next, the regulations have specific rules on excluding employees from the workplace, either when they have contracted COVID and they test positive or they have symptoms, or in situations where they are exposed to COVID in the workplace. And we'll talk in more detail about what those rules are. But again, a lot of this has been, thrown about there, whether it's the CDC guidelines or the California Department of Public Health guidelines on when people have to quarantine and how long they have to stay out of work. And it's created a lot of confusion. Well, now Cal-OSHA has stepped in and said, no, these are the requirements, no matter what CDC or California Department of Public Health says. If it's a workplace, you need to follow these rules when it comes to keeping people out of the workplace who have or may have COVID. Next, and this is a significant addition to what we've been dealing with over the last 8 months, the new regulations require that you as an employer provide free testing to employees who are exposed at the workplace. In other words, if you identify someone, and I'll talk about the definitions in a second, who is a COVID case, who is positive for COVID, and they were in your workplace during the period where they could have transmitted it to other employees, then you need to offer free testing to those employees who were exposed. And we'll talk about the testing requirements in a little more detail. And finally, and this is I think a big overreach by Cal-OSHA, but nevertheless, this is what the regulations provide. You have to continue paying people who are infected or exposed at the workplace during the period that they cannot come to work. And we'll talk about the rules and some of the exceptions as we get a little bit farther into the presentation. But that's our basic overview of the regulations. Now I want to get into some of the details regarding the regs. And first, and it's important to understand how this all fits together, you need to understand some of the key definitions under the regulations. So let me cover that. First, a COVID-19 case. What is a COVID-19 case under the regulations that trigger some of these requirements for notice and testing and paying people, et cetera? So under the regulations, if an employee tests positive for COVID, or if they are subject to an order to isolate issued by a local or state official. And here's where one of those ambiguities. What I wrote on this PowerPoint is pretty much word for word from the regulations, okay? The question is, the ambiguity here is that a order that is specific to that employee? Or is that one of the general stay-at-home orders that the state or the county has issued where, for instance, under the current orders, if someone has symptoms, they are supposed to quarantine? As of right now, my interpretation is that the intention here is that a COVID-19 case would be somebody who has symptoms and is therefore subject to the general order that they have to quarantine, even before they actually get test results that they've tested positive. But again, that is ambiguous. So in my review of the regulations and the facts, the frequently asked questions, I think this is supposed to be a general definition of a COVID-19 case. It's not just, oh, I haven't tested positive yet, even though I have all the symptoms, so I'm not a COVID-19 case. Once you have symptoms, you're subject to an isolation order. And if you're subject to an isolation order, you qualify as a COVID case. You are no longer a COVID case, or an employee is no longer a COVID case, when a healthcare professional determines the employee does not have COVID-19. So again, a little bit of ambiguity here. Does that mean when someone tests negative, they are no longer a COVID-19 case? And the regulations do not say that merely testing negative makes you not a COVID-19 case. The regulations specifically say you're no longer a case when a healthcare professional says you're no longer a case, which raises the question, is it enough for somebody to bring in a note or a test report saying that they've tested negative? Or do they have to go to a doctor, have a doctor examine them and say, yes, this employee is COVID-free? We don't know the answer to that yet. We're hoping that there's going to be some clarification on that. The Cal-OSHA board is holding a meeting on December 18th to address some of these ambiguities, and we're hoping we'll get some more guidance. But as of right now, it's unclear whether or not a negative test result, clears somebody as a COVID case. Next, definition, COVID-19 exposure. So an exposure, and this is very similar to the CDC guidelines. An exposure is defined as being within 6 feet of a COVID-19 case, somebody who has COVID-19, with or without a mask on, with or without a face covering. And you are within 6 feet of that person for a cumulative duration of 15 minutes within a 24-hour period. In other words, it does not have to be a consecutive 15 minutes. It could be 5 minutes here, 5 minutes there, within 24 hours. And that exposure occurred during the high-risk exposure period, which is another definition we'll get to in a second. So if an employee is defined as a COVID-19 exposed individual, that triggers certain things in terms of quarantining them and requiring pay, et cetera. And the definition is based on they have to meet those criteria. The high-risk exposure period for defining when an exposure occurs is the 48 hours before the employee develops symptoms until 10 days after the symptoms started. So it's basically the 2 days prior to them starting to have a fever or starting to have a cough or whatever COVID symptom it is. And then from the date the symptoms started until 10 days later, they're in a high-risk exposure period. So during that period, if they're at work and they have close contact with other employees, there is a COVID-19 exposure. But also for people who are non-symptomatic, and there's a lot of people who are asymptomatic right now, the definition of a high-risk exposure period is 48 hours before and 10 days after the employee without symptoms tests positive. Not when they get the test results, but when the sample was collected that led to a positive test result. Last definition I want to cover is an exposed workplace. What is an exposed workplace? Because again, that definition triggers a lot of these requirements that we talked about at the outset with respect to testing and notifications, et cetera. So an exposed workplace is an area, a work location or a common area that was used by an employee who is a COVID case during a high-risk period. So for instance, if there is a office area and that office area is shared by a number of employees and a COVID case was in that office area around other employees, maybe the 2 days before they started experiencing symptoms, that is an exposed workplace. Now, an exposed workplace would not include buildings or facilities that the employee did not enter. So let's just take a workplace where you've got one big office area, which is walled off, separated from another office area where other employees work. Or maybe it's 2 buildings on the same property, okay? If the COVID case employee only went in one of the buildings or one of the work areas, it did not go in the other work area, that other work area would not be an exposed workplace. And what that means is, we'll see a little bit later on, is now you don't have to give notice and test and do all the other things that you would be required to do in that other building because it's not an exposed workplace. Now, that raises a whole bunch of issues about whether or not somebody's transiting through that area for a limited period of time, and how long do you have to be in there to create the exposure? And again, there's some ambiguities with respect to that. So just to use an example, if it's a hallway and the COVID exposed employee just walked through the hallway a couple times during the day, very momentarily, quickly, I would say that's not going to be an exposed workplace. However, if it's a shared bathroom and people use the bathroom frequently, and that could be an exposed workplace. So it's going to be a little bit tricky sometimes to determine that, and that's where you need to get counsel either from an attorney or from an experienced safety consultant. So let's talk real quick about the prevention program. I'm not going to go into a lot of details about this because there's a lot of companies out there that, again, are offering to prepare COVID prevention programs. And certainly you can take what you already have in place and modify it. But let me just go through a few of the details regarding this. Number one, it must be a written program. It must be a written program. You have to have something that says on the front cover, COVID prevention program. Now, that could be integrated with your injury, illness, and protection program. Injury, illness, and prevention program, which you should already have. Or you can have a standalone document. It does not necessarily have to be integrated into your current IIPP or your employee handbook, for that matter, to create one document. It can be a standalone. There is a model prevention program on the Cal-OSHA website that you can utilize and fill in the blanks and create your own prevention program. So that is a really good resource. If you just Google Cal-OSHA COVID, the website pops up and it's on there. And if you look at the frequently asked questions, there's also a link in the frequently asked questions. You must include in your written program some key elements as set forth in the regulations. The key elements are you have to have hazard identification protocol, you have to have cleaning and safety protocols, you have to have a training protocol, a protocol for communicating with employees regarding COVID. It's all laid out in the regulation. Again, time doesn't permit me to go through each element. My recommendation would be, if you want to update your own prevention program yourself, go online, look at that model prevention program. It's going to give you all the information that you need. Now, as part of the prevention program, there's some general information that you must communicate to employees, whether or not you have a COVID case at the worksite or not, okay? As part either of your COVID prevention program that you give to employees, or as part of general communications in writing to employees, you need to, first of all, notify employees how they can report whether they've been exposed in or out of work, or whether they have symptoms, or whether there's a workplace hazard. They think there's something going on in the workplace that may create a hazard of exposure. You need to let them know how they can report that without reprisal. And you need to reassure employees that when they report things related to COVID exposure or symptoms or hazards, there's not going to be any retaliation. So you need to make sure you have some document that communicates that to employees. Next, you need to have some document that gives them some idea of what we have done to identify COVID hazards in the workplace. You need to notify employees of potential accommodations available, if any, for employees at a higher risk from COVID-19. That would be people over 65, people with underlying conditions that create a greater risk. Notice it says, if any. The COVID regulations do not require you to accommodate, for instance, people over 65. All they require is that if you do have programs or protocols in place to accommodate people, that you communicate that to your employees. Next, you need to communicate to employees how they can obtain testing, whether that's testing through a company-sponsored program, testing through your healthcare provider, or testing through public testing options. And you need to communicate to your employees regarding cleaning and disinfection protocols. What are we doing to make sure that we're cleaning and disinfecting the high-touch areas of the facility on a regular basis? Finally, how to participate in hazard identification, how employees can participate in figuring out where we might have some hazard that could lead to COVID transmission. The regulations also require that employers do certain things to try to control infection in the workplace. And this is where we get into physical distancing and mask wearing. So with respect to physical distancing, probably most of you have already implemented programs to help employees not get within 6 feet of each other for extended periods of time in the workplace. The regulations are very specific, however, that you must maintain 6 feet of separation between employees, except where that is not possible due to the nature of their work, or in situations where employees are moving, are going through a hallway, they're not congregating, they're not stopping. Okay, so people can pass each other in the hallway within 6 feet, but in areas where people are stopping and they're going to be there for more than just a moment, you have to take steps to make sure people are maintaining that 6 feet of separation. If 6 feet is not possible, then you must do something to try to make sure people are spaced as far as possible within your operation. That means moving desks. That means putting up partitions. Whatever you can do to try to maintain that distancing, the regulations require that. The regulations state that you must engage in methods to try to maintain that 6 feet of separation. And that would include things like marking the floors for spacing, for direction of travel. If there's hallways, people should just go one direction so they're not passing each other constantly. The regulations specifically mention telework. If people can work at home, and that would help maintain 6 feet of separation, because if they were at the office, they wouldn't be able to maintain 6 feet. You probably should grant telework rights, provided, of course, that they can perform their essential functions at home, and staggering shifts. So a lot of this is probably what your business has been doing during the course of the pandemic. But now that these are in specific regulations, of course, that gives Cal-OSHA the ability to come in and make sure that you are following these regulations and to issue citations if you're not. And that's the importance of making sure that now these regulations are out there, that you're in compliance. Face coverings. This is an important change. Obviously, we've been living with the face mask thing for a while, but there wasn't a specific requirement other than that you had to provide face masks to people and try to get people to wear face masks in the workplace. But now under these regulations, it's very specific that not only do you have to provide face coverings to employees if they're not bringing their own to work, you also must require their use when employees are indoors or when they're outdoors and they're within 6 feet of each other, with the following exceptions. When an employee is alone in the room, if someone's got their own office, like I'm in my office right now, and you're alone in the office, you do not have to wear a face mask. Or when employees are eating or drinking in lunch areas or wherever they're doing that, and they're more than 6 feet away from each other, that's okay for them to take off their masks. Or when the employee has a certified medical condition or disability. They've got a doctor's note that says that due to a medical condition, they cannot wear a face mask, but in those circumstances, they must wear a face shield. And then finally, when tasks cannot be feasibly performed while wearing a mask, and employees are more than 6 feet away from each other, if employees cannot be 6 feet away from each other and they're not wearing a mask indoors, then you need to require employees to test twice weekly. So in other words, you need to make sure that people are wearing masks, and in those very, very small exceptions where they can't, like for example, customer service people on the phone, they can't talk while they're wearing a mask. in answering the phones, you got to make sure that they're 6 feet away from other employees while they're doing that. If not, you got to test them twice a week. Now, the other thing I want to mention before I get to cleaning and disinfection, the face coverings required under this OSHA reg are cloth masks. Okay. They are not face shields. So you cannot allow an employee to wear a face shield as a substitute for a mask unless they have a certified medical condition or disability. Okay. So now an employee can wear a face shield and a mask. That's fine. But this is the big change. The OSHA reg specifically says it's got to be masks unless one of these exceptions applies. Next, infection control. You need to make sure that you're cleaning and disinfecting. That means regularly for frequently touched surfaces, at least once a day, and deep cleaning where you have a COVID case during a high exposure period. Whatever work area they were working in, you need to make sure that you're doing a deep cleaning in those areas. Otherwise, that could be considered a violation of the COVID regs, which probably most of you are doing. But again, it's important to keep in mind, you know, now more than ever, you need to make sure that not only are you doing that, but you're keeping a good record of it. And record keeping is part of this. And again, because of time, I don't have time to go into all the record keeping requirements, but it's important to keep records of your cleaning and disinfecting when it's being done and what your protocols are. Okay, situations where you have a COVID case and there is an exposure. This is where we really get to the nitty gritty and the important things to understand about these new regulations. First, you need to determine whether notice is required. And when I'm talking about notice, I'm talking about notice to employees. You need to develop first, or find out first, when did the employee first develop symptoms or test positive? What was that date? Okay, because that date is going to tell you whether or not they were in the workplace during the high risk period. If, for instance, as I had with some of my clients, they first developed symptoms on Thanksgiving Day and they were out of work for the 4 days until Monday. And on Monday, they reported that they had COVID. Well, if they were in work the 2 days before that, they would still be at work during the high risk period. However, same scenario, but employee developed symptoms on Saturday. Now the 48 hours prior to that Saturday was Thanksgiving, and the day after Thanksgiving, they were out of work. There is no exposure. So you need to first figure out, when did they first develop symptoms, or when did they first provide the sample that led to a positive test? Second, when and where was the employee at the workplace during the high risk exposure period? Where did they typically work? Did they go into any other areas for a meeting, etc.? Third, who was the employee in close contact with during the high risk exposure period? And this is where you really need to get that information from the employee who has COVID, because you can't go around to your employees and say, hey, Joe's got COVID. Did you have close contact with him? Because the regulations are very clear. As you probably all know, you cannot disclose the identity of someone who has tested positive or has COVID. So once you've got that information and you determine, yes, we have a COVID case that was in the workplace and had close contact with employees during the high risk exposure period, now you've got to give notice to those employees who have been exposed. And the notice must be given to exposed employees within 1 business day of discovering the exposure. So once you figure out that, yeah, we've got somebody who's tested positive, you asked all those questions, you determined there was exposure due to close contact, now you've got to give notice to that employee or employees who were exposed. And you got to do it within 1 business day. You don't have to do it over the weekend if you're not open over the weekends. As I mentioned, you cannot disclose personal identifying information of the employee with COVID when you give this notice. The notice does not have to be in writing under the Cal-OSHA regulations. But, and I tried to bold that, but it should have been underlined, I suppose. Once AB 685 goes into effect, which is a separate bill, separate from these Cal-OSHA requirements, when that goes into effect on January 1st, 2021, you have to give the notice in writing. As of right now, it could be oral, but it's probably a good practice to start with written notice. Now, when you give notice to employees that they have been exposed, you must also inform them they're eligible for testing paid by the employer during working hours. So in other words, employees who are exposed in the workplace are eligible for you to either provide testing to them by bringing in a testing outfit and making that testing available at the workplace during work hours, or they can go get tested elsewhere. Okay, so now you've got somebody who is a COVID case, you've got somebody who's exposed. What do you have to do in terms of keeping them out of the workplace? Here's what the regulations say. When you have a COVID-19 case, somebody who has been infected, if they have symptoms, they must stay home for 10 days from the date symptoms appeared, and they can only return if they've had no fever within 24 hours and their symptoms have improved. So, employee has symptoms on December 10th, okay? They can't return to work until 10 days have passed. So that would be December 21st. And you have to verify with them they haven't had a fever within 24 hours and they're not using any fever reducing Tylenol or anything like that. And their symptoms have improved. Their symptoms don't have to have disappeared, but they at least have to have improved over that 10-day period. If employees don't have symptoms, they tested positive, but they're asymptomatic, they must stay home for 10 days from the date they were tested. Again, the date the sample was collected, not the date that they got the positive test result. Okay? If you have exposed employees, these are people who don't necessarily have COVID, they've tested negative, they don't have symptoms, but they were exposed in the workplace. And this is where the Cal-OSHA regs differ from maybe the CDC guidance. They must stay home for 14 days after the last known exposure at the workplace. And that CDC requirement of 10 days or 7 days, or, you know, they've been moving that down recently, that's not applicable. The regulations are clear. If you're exposed, you need to stay home for 14 days. And a negative test, there's nothing in the regulations that say if the employee goes and tests negative, after 5 days, they can come back to work. The regulations say you got to stay home for 14 days. The regulations also say that a negative test is not required before the employee returns to work. Whether that's an employee who has COVID or an employee who was exposed. Now, this is, again, an ambiguity, right? The regulations say a negative test is not required, okay? The ambiguity is, can an employer require a negative test before an employee comes to work? The way I read the regulation, it could certainly be interpreted as you can't require a negative test as a condition of coming back to work. So until we get clarity on that, which hopefully will happen on December 18th, my advice right now would be don't require people to test and test negative before they return to work. Because the facts, the FAQs state that the only requirements are that they've been out 10 days, they have no fever within 24 hours, and their symptoms have improved. Okay, I know I'm moving very quickly, but I'm cognizant of the time, and I want to give some time for questions. Here's the other thing that has engendered a lot of confusion, and that is the Cal-OSHA reg that you've got to pay employees when they're excluded from work. So what the regulations say is that if employees have to stay home because either they've got COVID or they were exposed at work, then you got to maintain their pay for that period, whether that's the 10-day period or the 14-day period. Now, there's some qualifiers to that. This only applies where employees are infected or exposed at work. If an employee reports, oh, wow, my sister has COVID and now I have symptoms and I can't come to work, then that is evidence that they were not exposed at work. They were exposed outside of work. And in that circumstance, Cal-OSHA doesn't require you to pay them. We'll talk about whether they have to get paid elsewhere. But under this standard, it only applies when the employee is either infected or exposed at work. That's the only times you have to keep paying them. So it doesn't apply where an employee is affected or exposed outside of work. Now, how do you know? Most of the time, you either have a questionnaire or you talk to employees and they disclose, yeah, family member has it. I got infected because I went to a party. Somebody told me they were infected, et cetera. The burden, it falls on the employer, however, to establish that the exposure was outside of work. The other exception here is, of course, the employee must be available and able to work in order to get paid. If the employee says, wow, I've got COVID, I'm in the hospital, they're not available to work, you don't have to pay them for that period. It's only when, hey, I could work and I'm not able to work because I can't come to work because you're excluding me under these regulations, now you have to continue paying them. If the employee is able to telework, right? They have COVID, they don't have severe symptoms. They're like, yeah, I can work. And you're all right with them teleworking, then basically they can continue working during that exclusion period or that quarantine period, and you keep paying them because they're teleworking. So you don't necessarily have to pay them for doing nothing if they can perform work during that period. Again, as I said, the employer is the one that must demonstrate the exposure was not at work in order to avoid pay continuation. Unlike FFCRA, which we've been living with since April, that requires you to pay 80 hours to people who are sick with COVID or taking care of someone with COVID. Unlike FFCRA, you can use the employer's sick leave benefits to cover that pay continuation requirement. So for instance, if you pay employees 5 days of sick leave and the employee's got 5 days of sick leave on the book, you can use that sick leave to cover some of that 14 or 10-day period. And lastly, that would overlap with FFCRA paid sick leave benefits. So if you've got an FFCRA covered employee and they haven't used their sick leave yet, and they've got to be quarantined for 14 days because they were exposed at work, you can pay them their FFCRA, their 80 hours of FFCRA, and that would satisfy your pay requirements under Cal-OSHA. But as probably most of you know, the FFCRA expires on December 31st. And as of now, there's nothing to take its place. So after December 31st, you would not have to worry about FFCRA paid sick leave benefits, only the Cal-OSHA pay continuation requirement. Now, at the time you tell people, look, you've been exposed, you have to stay home, you need to tell them about that pay continuation benefit. And again, probably a good idea to put that in writing. I want to talk finally about COVID outbreaks. The regs have specific requirements that you must follow if there is an outbreak at your workplace. And these are very similar to what is in AB 685 that goes into effect on January 1st. It's just that Cal-OSHA jumped the gun and said, no, we're going to put these into effect now. So what is an outbreak? An outbreak is where you have 3 or more COVID-19 cases among employees in a 14-day period, no matter the source of the infection, whether they got infected outside of work or at work, it doesn't make a difference. If they were in your workplace while they were in the high-risk exposure period, that's going to count as a case. And if you have 3 of those within a 14-day period, you have an outbreak. Now, this is, of course, within the same workplace, right? if you've got multiple locations and you had 2 people in Anaheim and 1 in Irvine, that wouldn't count as an outbreak. So it's just within the same workplace. And if people momentarily transit work areas, then they don't necessarily share the same workplace. Let's say you've, like some of my clients, you've got a worship area and a school area at your particular location. And the employees who work in the school area stay in the school area, and the employees who work in the worship area stay in the worship area, and they don't intermix, then it would be defined by 3 or more cases in the worship area or 3 or more cases in the school area. It is still considered an outbreak until you go 14 days without any further cases. Now, what does that mean? It means you, number 1, have to give notice. You must notify the County Department of Health of the outbreak within 48 hours of detecting the outbreak. So you need to let the county know the total number of cases that you've had, the name, contact info, occupation, work location, and hospitalization status of each case. You've got somebody in the hospital, you need to let the Department of Health know that when they've been at your workplace. And you must continue to notify the Department of Health of any subsequent cases. And most importantly, when there is an outbreak, it triggers a testing obligation. You must provide testing to all employees at the exposed workplace immediately and once per week during the course of the outbreak. Now, notice that's all employees at the exposed workplace, not all employees who may have been exposed to the COVID case. Okay, so it's a different testing requirement, and this is, again, it's ambiguous as to whether or not you just have to provide the free testing or whether you have to force people to test. There's the wording they use in the regs and the frequently asked questions kind of makes it sound like you got to require testing, but it doesn't actually say that. It just says you have to make testing, provide testing. It's got to be free. But the important thing is, in an outbreak, you need to offer that testing to everybody. If it's just one case, you only need to provide that to the people who were potentially exposed. As I said, it's unclear whether testing is mandatory or just must be provided. Like previously, it must be free for all employees and offered during work hours. Okay. That is the end of my presentation. So I wanted to open up to questions.
Thanks, Eric. Really appreciate it. We have a lot of questions, and we will try to get through as many of them as we can. Brittany will ask them in the order they were received, and maybe if you're up for it, we might go a few minutes after 2 for those that can stick around and want to hear answers. We'll try to get to as many as we can. And so Brittany, with that, go ahead and take it away.
All right. First question we have from Tom Waugh. I think this was pertaining to your first slide, Eric. What about the person that works 1 to 2 hours per week?
What about the person who works 1 to 2 hours per week? Are they still governed under the guidelines? Yes.
Okay.
Yeah, it doesn't matter, if they're an employee, they're working in your workplace, doesn't matter.
All right, thank you. Next question here from Berlinda Gomez. If our employees work 90% remotely and are on site 10% of the time, are they exempt from these new requirements?
They're exempt from the requirements when they're working off-site, right? So, for instance, if they get exposed, let me just use an example. Let's say they're working at home and they get exposed at home because their husband has COVID. Okay. Well, that would not be a workplace exposure, even though technically when they're working at home, that's their workplace. So the regs do not apply to employees working at home. However, during that period of time that they're at your work site, even though it's only 10%, yeah, the regulations would apply. Okay,
thank you. Next question here from Ethan Lawton. Does training for employees include volunteers?
The regulations are specific to employees. My recommendation would be, if you have volunteers who are regularly interacting with employees, I would give them the training as well. That way you can show that you've crossed your T's and dotted your I's.
All right, thanks, Eric. Next question from Greg Smith. Do Cal-OSHA regulations apply to nonprofits, churches with no paid employees? That is, all participants in activities at the church are unpaid volunteers.
If they're unpaid volunteers and there are no employees, people who are paid, then you would not be governed by the Cal-OSHA regulations.
Okay, thank you. Eliza Golan asks, what about exposure outside of the workplace?
If employees are exposed outside the workplace and they come into your workplace during that high risk period, that's still going to trigger all the things that we talked about in terms of notice to exposed employees, other employees who were exposed to that individual, et cetera. The big difference is if they were exposed outside the workplace and now they have to quarantine, you don't have to pay them under the Cal-OSHA standards. Still may have to pay them under FFCRA, at least till December 31st, but not under Cal-OSHA.
Okay, thank you. Julie asks, can you provide a link to the official document that outlines all the requirements?
I can. I don't know how to do it right now.
We'll send that out with the presentation.
Yeah, I'll make sure it goes to you so that, yeah, if you want to Google it, just Google COVID-19 emergency regulation and the actual document will pop up.
Awesome. All right. Phil Feinberg asked, can the testing be the standard or can you be forced to do a quick test?
The testing is supposed to be testing that is recognized as effective. So it's either the PCR test or the antigen test. You cannot require employees and should not offer the antibody test.
Okay.
The antibody test merely tests whether you've had it.
Got it. All right, next question here from Karuna Training. What about if employees are contract employees?
These would apply to contract employees as well. And my advice is that as the employer who's employing contract or staffing agency employees, you want to coordinate with the staffing agency, but you're pretty much on the hook as a joint employer. So you better make sure you're following the protocols.
Okay, thank you, Eric. Next question here from E. Jungiger. Are masks at workplace required if there is an express county exception that allows masks not to be worn?
No. So the Cal-OSHA guidelines take precedence in the workplace over whatever the county says. Now, the county may exempt people from wearing masks out in public or whatever, but that doesn't apply in the workplace.
Okay, thank you, Eric. Next question here from Joseph Hansen. How does the pay work if staff test positive and then test negative after that, indicating a false positive test result?
Oh, that's a really good question. I would say, number one, it would depend on whether or not they're experiencing any symptoms. If they're not experiencing any symptoms and it appears that there was a false positive, I mean, there's no guidance on that. I think you could, in that circumstance, possibly have the employee come back, but there would be some risk to that. The safe thing to do, even if you think you got a false positive, would be to keep them out of work from 10 days for the first test date, not the results date, because by the time you get the second negative, it's probably going to be 10 days anyway. You know, the way things are going with testing right now. So that's probably the safe thing to do. And then you continue the pay.
Okay, thank you, Eric. We have a question here from Blake Inscore. The exception rule is provided to workplaces where there is only one employee who does not have contact with other people. We are a small church, and I, as the pastor, am the only employee. My question is, how should we interpret the statement, does not have contact with other people? Thank you.
Right. So it's a great question. If you're the pastor, you're the only employee, and you don't have, because there's no other employees to have contact with, even though you have contact with the people who come to your church, the OSHA guidelines wouldn't apply because you're a single employee in the workplace.
Okay. All right, next question from Phil Feinberg. What about second degree of separation? So a worker tested positive, a second individual was exposed to that person on a Saturday, a third person was exposed to the second individual only. Eventually, the second person tested negative.
So the third degree of separation from Kevin Bacon, sorry, joke. The third degree would not be subject to an exclusion order, okay? Unless the second person that they had close contact with ultimately tested positive. If they tested negative, yeah, you can't go 3 or 4 steps down the road on exposure. You got to show that the exposure was to someone who has COVID,
Okay.
as opposed to someone who might have COVID. How's that?
Got it. All right, thank you, Eric. Next question here from David Coe. How do the rules apply to an infected guest in the workplace?
To an infected guest in the workplace? Okay, so you have a duty as an employer to make sure that your employees are not exposed to a COVID-19 hazard, a hazard of transmission. So if you know that somebody is coming into the workplace, even though they're not an employee, that has COVID, you need to exclude them from the workplace, because that would create a hazard of transmission, which you could then be liable for. Obviously, if you don't know, that's a different story. But if you have knowledge that someone is either exhibiting symptoms or has tested positive for COVID, yeah, as an employer, you have an obligation to take steps to keep them out of the workplace.
Okay, so we have 2 anonymous questions. The first one, are private schools required to employ with these new guidelines?
Yes, they're an employer.
To comply with these new guidelines.
Right. Yeah. It doesn't matter if it's a private school or they're a workplace.
The other question is wondering about a choir or band playing during church services.
So, so good question. A choir or band playing during church services could be a COVID hazard because singing, spreads droplets, right, to any employees who would be at the church service. Okay, so as an employer, you would need to take steps to identify that hazard and see what you can do to remedy that. Whether that's, as at my church, the singers are away from everybody and they're outside, or putting up a barrier, something where you would keep employees away from the potential COVID transmission. Now, there's a whole different set of circumstances with respect to the choir versus the congregants, but not time to get into that.
Next question here from Doug. Do the regulations that affect do the regulations affect nonprofits that only have volunteers?
Right, yeah, so if you're a nonprofit, you only have volunteers, you don't have employees, the Cal-OSHA regs only apply to employees and employers.
Okay. Next question from Joseph Hansen. If everyone in your workplace has been vaccinated, are staff still required to wear a mask?
Well, they haven't yet. I know that. So the question is when people get vaccinated, and it's a very interesting question. The regs don't have any statements about vaccination whatsoever. If there's going to be some relaxation of that down the road, that would be up to Cal-OSHA to modify the emergency regs. As of right now, the regulations say you got to wear masks. So it doesn't matter whether you're vaccinated or not.
All right. Question here from Blake Inscore. Do these guidelines apply to volunteers who come to the church during the week? Volunteer treasurer, volunteer janitors?
Okay, editorial comment. You gotta be careful about volunteers doing work, right? Because I've had cases in front of the Department of Industrial Relations about people saying, yeah, I wasn't a volunteer, I should have been paid, right? But if they're bona fide volunteers, then they're not employees. And if they're not employees, then the regulations wouldn't apply.
Okay.
If they're bona fide volunteers.
All right, thanks. Question here from Lisa Berry. What about face shields in the classroom?
What about face shields in the classroom? So the issue is it a workplace? Meaning, is there more than one employee in the classroom? If there is 2 or more employees in that classroom workplace, then while they're in that workplace, they are supposed to wear masks, not face shields, under the regs.
All right, here's an anonymous question. If there is a building with multiple offices and the employee only works in one office, do we need to notify the entire building?
Right. So again, this gets back to the definition of an exposed workplace, right? Did the COVID-19 case, the employee who has COVID-19, spend any significant amount of time in any common area of that building? Or did they just go into their personal office or an office where they were working where nobody else was working, and any contact they had with other employees was momentary? Under the Cal-OSHA guidelines, you would not have to give notice to everybody who works there. You only have to give notice to the people who are exposed. And in the scenario that you described, there's very unlikely that somebody's been exposed.
Okay. Question here from Michelle Lovely. Do these obligations apply when volunteer members are performing work in the workplace?
Again, this goes back to the definition of what's a volunteer. Okay. And when people are performing work, whether they're compensated or not, the argument could be, and this is why I'm kind of hedging here, the argument could be that they should be considered employees. I mean, volunteers are supposed to be, they're not supposed to be cleaning the stalls, okay? That's work for the employer. And so I think you've got to be careful between distinguishing somebody who's teaching Sunday school versus somebody who is coming in and cleaning the carpets or something like that. I think in the latter case, I'd be a little bit concerned.
Well, thanks, Eric. We kept bailing water out of the boat, and the boat kept getting fuller, more and more full. You've answered 31 questions, and we started with 40 something, and now we're up to 49 more. So here's what we can do. We're going to try to, after the fact, and I don't want to put you on the spot, but we'll try to offline answer as many of these as we can and include those answers back to the people that asked them, or maybe we'll just put it in a general format with the link. As I said, the link to this presentation will be available and sent to everybody that attended in a couple days. And we'll try to get to as many of these unanswered questions as possible. So Want to thank you, Eric, again. Very good info, very obviously timely info. And I want to thank everybody for attending and sticking around, those that did for a few minutes afterwards. And thank you very much.
Thank you.
All right.
Thank you.
Bye, guys.
Bye, everyone.